Racism's the theme of the day because it's Monday in America. Okay? So this is what we're doing, racism. It's now the start of your week. Racist nursing student exposed by Black TikToker. This is a whole new profession. Okay? Let's show you the video of her putting him on blast.
This is James. James wants to be a nurse. James also doesn't like darkies, and he's racist, and he calls people the N-word. So I called his college, High Desert Medical College in Lancaster, and I let them know that. James doesn't like darkies, and he is racist, and that he shouldn't be a nurse because Black people also have to go to the doctor, James. I also contacted the California Licensing Board for Nurses and let them know that as well. I also sent the message to your mother and stepfather on Facebook, letting them know everything that I did as well. I don't think that they would be proud of you. Bye. Have a horrible day.
I want to address the smile that she did it with, and then the little petty thing at the end she did. I don't blame her.
With millions watching and many people benefiting from this program called Indisputable, we just need 1% of the viewers to become a paid member so we can continue to bring this content to you. Now back to the show.
But I think despite the smile and the pettiness at the end, she's a hero. I actually mean that. Because if someone hates darkies and likes to call people the N-word, we can't trust James to take care of them. We can't trust James to check his racism, racist behavior at the door. Can't check that at the hospital door. Let's give you more. The online exchange you saw between the TikToker, Day Baby X, and the nursing student. She opened the conversation with, "Hey, how's your day going?" That's what I mean, her little, she just had this affect that made me laugh. But there's not an appropriate way to address racist, so I'm fine with it. To which he replied, "Sorry, I'm racist." She asked, "What?" He said, "I'm racist, don't like darkies." She would laugh at him saying, "Mad because you're not like us? They not like us. Get a life." And he would end the conversation with, "Okay, N-word." So we're not even talking about an inappropriate joke here. I got to check you if you're joking with me like that. He means it. He's an intentional racist. Labels are good sometimes. We know what we're dealing with here. Okay? Implicit bias and racial disparities in healthcare. Indisputable. Dr. Richey has been all over this for years now. You know it too. Yep. Scores of studies have the findings documenting providers are less likely to deliver effective treatments to people of color when compared to their white counterparts, even after controlling for characteristics like class, health behaviors, comorbidities, access to health insurance, health care services. For example, one study of 400 hospitals in the United States showed that Black patients with heart disease received older, cheaper, and more conservative treatments than their white counterparts. It makes me so mad. American Bar Association with that. Black patients less likely to receive coronary bypass operations, angiography. After surgery, they're discharged earlier from the hospital than white patients at a stage when discharge is inappropriate. Same goes for other illnesses. Black women less likely than white women to receive radiation therapy in conjunction with a mastectomy. In fact, they're less likely to receive mastectomies. Perhaps more disturbing is that Black patients are more likely to receive less desirable treatments. The rates at which Black patients have their limbs amputated is higher than those of white patients. Additionally, Black patients suffering from bipolar disorder more likely to be treated with antipsychotics, despite evidence that these medications have long-term negative effects. Not effective either. And then there's the whole dialysis and kidney situation. Whites get somehow more transplants, Blacks get dialysis. Not even told oftentimes. They just changed the criteria, by the way, to kind of see who deserves what. It's ridiculous. That's why, as I said, she smiled, sure. And then she signed off with, "Have a horrible day," I think she said. She's a hero. Mm-hmm. This person should not be allowed to enter the nursing profession, should be barred from healthcare because they're not fit. What say you?
Yeah. I mean, at least he's self-aware, I guess, but people who are unapologetically racist are the worst because they've convinced themselves that they are right to be racist, right? They've convinced themselves that they've intellectualized their racism and that they're justified in their racism because they can explain it to you. But if you admittedly hate a group of people, a specific group of people, why would you then pursue a career that not only requires you to interact with all kinds of people, but to care for all kinds of people? And you're absolutely right. This is why we like to talk about systemic racism, right? Because it is baked into our institutions and it allows people to act in racist ways, even if they're not racist, right? Because the system is racist, even if they're following protocol, the protocol is racist. We have instances across the country of Black people receiving less care than their white counterparts. We see more Black and women of color mothers dying in childcare more so than white women at increased rates around the country, right? And you can say that it's subjective. You can say that it's not an overt bias, but it is there, right? And we need to address it, whatever the reason behind it is. And again, how do we weed these people out of these types of careers where they have to interact with these people and care for them and provide the same level of care across the board? It's difficult because we're all human and every single human being has different motives and different interactions and different lived experiences that impact the way that they interact with other people in the world, whether or not they're aware of it, right? This guy is aware of it and he seems proud of it too. So you don't get to be here anymore, right? If you're admittedly a racist, you shouldn't be able to be a nurse. You shouldn't be allowed to care for other people.
Yeah, it's a profession with a shortage too. Well, they need more nurses, but not like this.
Yeah,
Not like
it's really
this.
scary, and if you pursue the career, if you do the work, then why wouldn't you graduate with the rest of your class? How do you then say, you did all the work, you graduated, you did your rotations, you did your internships and things like that, but you're a racist, so we have to kick you out. It's
Yeah.
a very tricky situation for the administrators and for his educators and things and everybody
Yeah.
involved.
They need to spend more time on bedside manner. I think that's like probably the shortest course for doctors a lot of times. But this needs to go top line. If you're biased, what you bring to the table can prevent you from doling out the best medical care, then that has got to be taught all the way through. And it's got to be weeded out. And you can do it if you're committed to it.